If you're someone who's recovering from an injury or looking to improve your athletic potential, having a physical therapist by your side is a game changer. However, if your physical therapist does not know what they're doing, not only will you fail to make progress, but you might even risk injuring yourself more. So today let's talk about 5 things to consider when selecting a physical therapist. My name is Dr. Shines Farr. I'm a doctor of physical therapy, a board-certified orthopedic clinical specialist, and the owner of Unity Physical Therapy. I'm also faculty at my graduate program, and I'm a professional stuntman, breakdancer, and a competitive martial artist. In my time as a professional athlete, I've seen different physical therapists, and as a physical therapist myself and being in the field, I understand that there's a wide variety of expertise in fields. So let's talk about the first thing you should consider, which is the type of expertise your physical therapist has. Now, many people think of physical therapy as someone that just helps with joint pain. However, there's many different fields of physical therapy. There's orthopedics, which is looking at muscles, bones, and that tends to be those people that help with pain or improving your mobility or muscle strength. There's sports, which are people that tend to work with more of an athletic population, pediatrics, geriatrics, neurology, cardiopulmonary, and even oncology. So for instance, if you're someone who's dealing with muscle and joint pain, someone who's trying to get more athletic, someone who wants to get better at moving, you're probably gonna want to see someone who does orthopedics or even sports. But if you're someone who's recovering from a heart attack, you'll go see a physical therapist, but they're probably gonna be a cardiopulmonary physical therapist instead. So once we select what kind of expertise we are, we're gonna go to number 2, which is the level of training that they have. Physical therapy is a new field. We recently just celebrated 100 years of a profession. However, because of that, the requirements to become a physical therapist have changed, and it's still not totally uniform. It used to just be a bachelor's program, and then a master's, and now in America, it's a doctorate level program. However, in some countries around the world, it's still a bachelor's or a master's. And then even beyond that, after you receive your diploma and your license, you have the option to do a residency or a fellowship. When we think about medical doctors, they have to do some sort of residency, which is essentially working as a licensed practitioner, but usually with the supervision and mentorship of someone else. In physical therapy, that is optional. And the statistics of the number of people who choose to do this is very low. Percentage of people who do a specialty certification is very low. Not all of them do a residency or fellowship. And I can tell you it makes a big difference. To be a specialist, and especially if you did a residency, means you were getting mentored, you were doing a lot of extra classes, and that means you had to study to pass a pretty difficult test to ensure that you have a really good understanding of the fundamentals of orthopedics. That is not the same as someone who just graduated from grad school. Personally, if I have a friend or family member that's gonna go see a physical therapist, I try to help find them someone in their area that is a resident trained and even a specialist clinician, because then I can be more confident in the quality of care that they're getting. So now let's go to the third thing, which is, do they have a niche that represents you? For instance, my clinic specializes in martial artists, stuntmen, surfers, because those are the sports I do. I understand the needs of those people, and so when they come to me with injuries or their goals, I understand them and can help game plan better. However, there's some clinics that really specialize in running, tennis, baseball, basketball, whatever it is. So if you can find a PT that has good training and a specialty certification and it also specializes in your niche, it's probably a good chance that they're going to be able to help you. Now, the fourth one is a difficult pill for a lot of people to swallow. However, the question is, does this PT take insurance or not? Now, I know having them take your insurance sounds wonderful because you'll likely save money. However, let's talk about some of the drawbacks. Believe it or not, a lot of physical therapists, including myself, do not currently accept insurance. The reason is, in order to get reimbursed by the insurance companies, we have to do certain things to bill and code, and we might not get that money to begin with. This is why a lot of physical therapy clinics have a huge volume of patients coming in, where one therapist might see 4 patients an hour, meaning 1 every 15 minutes, and then pass that patient off to an aide instead of spending the whole session with their patient. Because of that, they might not have the luxury of time to analyze and evaluate the needs and specific nuances of that case, because quite frankly, in order to keep the lights on, they have to see so many patients. This is why I don't take insurance. Because of that, I can spend the whole hour with my patient. Another drawback to these companies taking insurance is you'll see a lot of clinics will do things for their patients that they may not need, but that the insurance reimburses for. For instance, that insurance company might reimburse really well for a hot pack, for ultrasound, and electrical stent, but the research on the effectiveness of those things do not show its utility or effectiveness in almost most cases. So the clinic is essentially focused on making sure they get money from the insurance company instead of what does that patient need. This is why I don't take insurance, because at my clinic, I then can spend a whole hour with the patient instead of using aides to take care of it, so I got a lot of people in. This way I can really evaluate and analyze what my patients needs. I also don't have to answer to the insurance company, so instead of billing for ultrasound and hot packs and electrical stim that I know isn't going to help this patient, and and is just gonna take up their time, I'm gonna focus all my energy on exercise, hands-on therapy, whatever I think that patient needs, regardless if the insurance company is gonna pay me back for it or not. Because of that, oftentimes my patients and many of these people that just do cash pay see their patients fewer times. So even though you might be paying more money up front, you might have to do less sessions with that PT, saving you time and money. Plus, if you're getting better care, you're getting better results. You're reaching your goals faster, and when you're with a PT, they're gonna spend a lot of time with you. So I think getting quality care can really make a difference in your life. Think about when you had a really good teacher at school and how they changed your life with some profound impact because they spent a lot of time educating you. Your PT can be like that too. It's something to consider because let's say you see a clinic that you really like and they don't take insurance, it might be actually beneficial for you to go there instead. You have to check out their style and see if it works like that. Which takes us to our last one, number 5, which is what style do they have? Every clinician, whether it's a PT or a doctor, has their own biases. They have their preferred ways of treating their patients. They have an expertise that makes them more likely to do certain things. For instance, my styles, I like to do a lot of patient education to empower them. It's because I'm a teacher at a graduate program. I like to do a lot of hands-on therapy as well and exercise correction. However, some people might not like that. They might want someone who explains the thing a little bit less and maybe even uses things like hot packs and ultrasound. Some physical therapists are really focused on just reducing pain, and some are more focused on improving your mobility, strength, and coordination. Some like to use modalities like these hot packs and ultrasounds. Some don't use them at all. And that's okay, because at the end of the day, every patient is different. Everyone's context, their goals, their styles are different, so you just need to find something that matches you too. Because if you don't like the treatment you're getting, there may be alternatives. And if you're not motivated to stick with it and you're not going to, then what's the point to begin with? I hope that video helps you make a more informed decision about selecting the right physical therapist for you. You can find a physical therapist near you if you go to choosept.com. And if you want to find a specialist, you can go to specialization.apta.org. If you're in the Los Angeles area and you want to come see me, you can go to unityphysicaltherapy.com. Follow us at UnityPTLA on Instagram. Stay tuned for more videos on performance, wellness, injury recovery, and answering your questions. And I look forward to seeing you guys next time.